Good afternoon, everybody. Okay, nice to see one of our last speakers joining us. So we'll get started in just a moment. Again, for those of you just joining, welcome to the February Food Security Community Call. Please, if you wouldn't mind putting your name and organization in the chat. This is a broad topic of interest, so we may have folks joining us for the first time on this call or folks who haven't joined us in a while. So welcome. Glad you're here with us today. I'm Amory Hart Bookbinder, Director of Food Security Programs here at the Food Council. And just make a brief announcement before we kick things off and get started. Just wanted to share that the Food Council. We are thrilled to welcome a number of new Food Council and board members whose expertise from food recovery and SNAP policy to education, agriculture, and community health really help strengthen our leadership and our capacity to drive meaningful change across the county. So I believe Bita is sharing a link now in the chat where you can see the bios on our website of all of our Food Council members, including our newest ones. And many of you, I think, will see some familiar faces from the food security community. So particularly glad to have them and all of our new Food Council members. Before we kick things off on our presentations, evolving around the newly released dietary guidelines for Americans. I wanted to share the floor with Heather Bruskin, the director of the Office of Food Systems Resilience for Montgomery County, to share some updates from her office. So thanks for joining us, Heather.
Thanks so much, Anne Marie. Good afternoon, everyone. It is terrific to see you and be with you. I'm Heather
Oh,
Bruskin.
Heather, sorry, just your volume is a little low.
Let's see. How's that? Any better?
A little bit better, I think. Well, not much, maybe. Some faces saying not much.
How's that?
Perfect.
Okay. I had to flip my laptop upside down. So technology is wonderful, isn't it? So well, good afternoon, everyone. I'll try that again. Thank you, Anne Marie. I'm Heather Bruskin with the county's Office of Food Systems Resilience. It's terrific to see so many of our grantees and community leaders and partners here. And so I just really appreciated Anne Marie's invitation to come to the call today, just to share a little bit about what we have been up to, so that, I think we meet a lot in the context of grants and other things, but our terrific team is hard at work on lots of things. So just wanted to share a quick summary of some of those things with you, and happy to answer questions, but I know there's a lot of important stuff on the agenda as well today. So don't want to take time away from that. So our school-based food assistance grants, which were awarded at the beginning of the year, and a number of our grantees are here today, are operating programs at over 100 MCPS sites, and the format looks a little bit different, but these are all schools from K to 12 in the MCPS system. And so those programs have been moving forward really effectively, and we continue to work with schools to figure out how we can better connect families in trusted spaces with the assistance that they're looking for, particularly at a time when we know that families are hesitant to seek support, and really looking at their community for access to services. Our community food assistance grants, which again, many of our grantees are here. We have 57 organizations that are funded through that program overall, and with some special appropriation funds from a county council special appropriation in November, we were able to infuse additional support through that grant program to a number of organizations with specialties in services to through prepared meals, to services to the unhoused, as well as in a few specific zip codes where we've identified an underinvestment in food security programs. But with these additional resources, we hope that it is both quickly activated additional support on the ground, and also we'll be facilitating coordination of services, because while there's some additional support Now we anticipate that increasingly budgets at the county and the state level will be tighter in future cycles. And so the more that we can incentivize and encourage all of our partners to work together, we'll be able to close service gaps and also be able to hopefully reach more people with limited funds. We've also been working in food recovery and with the Food Council stepping in as the food recovery coordinator as entity for the county government's efforts. We have a number of organizations that are doing really important work out there, reducing food waste and picking up food to redistribute through the Food Assistance Network. And Yeti on our team is working on the OFSR side to coordinate Chow Match. So you may have seen her name pop up, but if you have questions about how you can get connected to that program, the Food Council and the OFSR staff is happy to help. And on the food economy side, I know we talk a lot about our food security initiatives, but we also are looking at ways that we can support increased production of food by our county's farms and other food businesses, and also make sure that they're connecting to different economic opportunities. And so there are policies in place that require state agencies to try to source as much food as possible, ideally a minimum of 20% of the food that they purchase from state food producers. And unfortunately, the best that any of these institutions are doing is probably less than 1% of all of their purchases, because it is really difficult to find places where you can buy large amounts of locally produced food for connecting to hospitals and correctional institutions, as well as other large scale facilities. And so to help bridge that gap, just last week, our team released a local food aggregator grant. And so this is designed to connect local farms, their product. So they each have small amounts. You can group all that together and then sell them to institutional markets and commercial wholesalers to hopefully give them the market access that they need to scale their production. Because while we talk most of the time about economic inaccessibility of food, with climate change and other challenges coming, our food supply needs to be more local. And in order to grow our self-sufficiency in terms of food production, we need to facilitate those market connections too. So I will be putting all this stuff in the chat box as we go, but wanted to make sure you all knew that that was out there and encourage you to share it with your networks. We also literally just right before this came from talking with the state about the Nourish MD program, which is a $2 million pot of funds that the state is making available to food retailers in communities that they have identified as having limited retail access for residents. So it's actually more limited than you might think, because it's really looking at where are there few spaces where you can actually buy food. So thinking about healthy corner stores, beer and wine foods, stores potentially carrying food in addition to their other products. And so this grant program actually allows businesses in these places to buy cold storage or other infrastructure that they might need to be able to increase the nutritious food that they are offering for sale. And so we're connecting with businesses to help them be aware of this and hopefully bring some of those grant dollars here to the county. And we're also talking with them about how we can potentially close some of the gaps for Montgomery County businesses that might not be eligible for the state program, but that we still want to support. Coming up next is our Food is Medicine grant program, which will be launched hopefully in the next couple of weeks. That's with the Office of Grants Management right now. This is a program that we've run for a few cycles and have been really thoughtfully evaluating all of the grant reports that have been coming from all of our dedicated grantees. And so we're also looking at state grants related to medically tailored meals and produce RX programs that are coming into the pipeline for how we can complement these. But we've been really recentering our FY26 Food is Medicine grant round around healthcare focused and centered programs, building on the research that has been coming out over the past year about which interventions are most successful. So stay tuned for that. And then finally, also want to share with the special appropriation funds, we have been increasing our grant funds to our nutrition benefit outreach organizational partners, because one of the major impacts of HR1, which was the One Big Beautiful Bill Act, made really significant changes to eligibility for SNAP participation. And we're anticipating seeing in the next month a lot of families losing eligibility due to changes in work requirements, as well as families that are losing eligibility due to changes for refugees and asylees and their ability to participate. So we've partnered with Instacart, building off of the success of our M Street Groceries program, to secure $100 vouchers. So these are emergency food funds or fresh funds codes to shop on Instacart. So as our NBO partners identify families that have lost SNAP eligibility, they can get a small amount of one-time funds to help put food on the table while they get connected to more sustainable resources. And so both the navigation team at the county's HHS, as well as all of our NBO grantee partners, who are all community-based organizations working with the state, will be able to help connect families with those resources, which are limited, but we hope can at least give them a little bit of buffer as they navigate that big transition. Our gardening grant program will be hopefully coming out in a couple months as well. We had a county council work session just this morning on that topic. And so there is a special appropriation in front of county council to add $100,000 to what is in the FY26 budget for that program, because there had been cuts to the county executive's recommended FY26 budget for that program. And so hopefully that will bring it back to $200,000 for this year's cycle. And once that's finalized, we'll be putting the finishing touches on that NOFO. And then I think just the last thing that I want to highlight is we've been doing, especially Juan on our team has been doing an incredible job taking all the data that comes in from your mid-cycle reports, your end cycle reports, from your submissions to the FAP census. That is all really important data that tells us about what's happening on the ground, about the health of our nonprofit sector and our community partners. And I can assure you that we carefully go through all of it and are synthesizing it to communicate it out. If you're not signed up for our newsletter, please do, so you can see we put little summaries of some of the key takeaways from each of our reports in those newsletters. We're also working on our FY26 impact report to really summarize all of that. But thank you all for your participation, because we can't analyze the data if we don't have the data in the first place. And you all are putting a lot of time and expertise into that. So thank you. And then finally, we're working with DHHS and the Services to End and Prevent Homelessness to better understand the unique food access needs of our county's unhoused residents, as well as the families that are living temporarily in hotels and motels across the county. And so how we can put some new strategies in place to specifically support them. And then finally, it's the budget season. So the county executive will be releasing his recommended FY27 budget in mid-March, probably I think on March 13th. And so that will then release his recommendations for funding for next year, and it will then go to county council for consideration. And there will be a number of hearings and committee work sessions to answer questions. And then council usually takes action on a final budget in May. And so this is when community partners' input is critically important, especially, the county executive is in the final decision-making process. But once that comes out, council gets really busy with understanding all the things that are in that really complicated budget. So your insight and voice are critically important. I will say I just in the mail today got a big envelope of postcards from some middle schoolers in the county who were encouraging us to invest in community food security. So I can say that our local youth are using their advocating voices, and encourage you all to do the same, and making sure that your perspective is informing the work of local government. So thank you, Anne Marie, for the time. I know that was a lot, but I hope it also just shares a little bit about how much we listen to what you're sharing, and are striving to not just create resources, but bring them in ways that are aligned with your strengths and needs and expertise. So thank you.
Thanks so much, Heather. And just a couple of quick notes on that. Again, for food assistance providers looking to connect and coordinate and collaborate, our peer learning circle monthly in-person meetings are a great place for that. And we thank one of our newest food council members, Randy Drury at the Clifton Park Baptist Church, for hosting the start of those meetings in January. That group food assistance providers will have a joint opportunity in February to meet with our food recovery collaborative at the site of the East County Partners Cold Storage Unit. That'll be happening in February 26th, and we've been sharing registration information about that. And also just stay on the lookout for registration link for our March food system advocacy call, where we will be discussing, the kickoff to the county budget cycle and how providers might want to engage in that process. So thank you so much for all of that information and allowing us to share where food assistance providers can connect in those spaces. I'm going to turn things over now. It is a wonderful opportunity to rely on the expertise and experience of our food council members. And this call is a great highlight of that, where we will be receiving presentations from two of our food council members. And I am going to turn things over now to Jennifer Dunbar, who's a registered dietitian with Trinity Health's PACE program. And she is going to walk us through the new dietary guidelines for Americans. So thank you so much, Jennifer, for joining us.
Thank you. Can everyone hear me? Okay. And I think Vita's going to pull my slides up. Perfect. All right. Well, I know we have a lot to cover today, so we'll go ahead and get started. I really thank you all for attending this particular call as we talk about the dietary guidelines for Americans. I think it is a perfect topic to talk about for this group because it covers so many of the things that we do. It covers nutrition, equity, policy, community well-being, and so I think it's perfect for the work that we do here. Just as a disclaimer, I'm going to be evaluating these guidelines through a nutrition and public health lens. So I'm going to be giving my thoughts and opinions as a registered dietitian. I don't necessarily, they don't represent the opinions of my employer, Trinity Health PACE. So as we go through these guidelines, I just want us to think about this question in the back of our mind, and that is, what impact do you guys think that these guidelines will have on our residents, on our local businesses, and our communities in Montgomery County? All right, so what are the dietary guidelines and why are they important? So these are more than just nutrition tips. These are really guidelines used as a public health tool, and they're meant to take really complex scientific information on nutrition and turn it into actionable advice for Americans. They also help us determine what's on the menu for schools, for daycares, for senior nutrition programs, for military cafeterias. So any program that receives any federally funded nutrition program has to align with the dietary guidelines. And so because of this, 1 in 4 Americans are affected by the DGAs. So if you have a child in MCPS, if you have a mom or dad who does senior nutrition programs in Montgomery County, you are one of the 25% of people who are affected by these guidelines. And it's important, oh, if you could just go back. Thank you. I think it's important because the work that we do with the Food Council, any shifts in guidelines are going to affect what local federally funded nutrition programs can purchase, which foods become higher priority or lower priority. And so the changes will ripple into our daily lives. So I just want to get some engagement here. If you ever have worked in a setting where the dietary guidelines shaped your menus, can you give me a thumbs up emoji? All right. I'm one of those as well. My program uses the Child and Adult Care Food Program, and I see lots of thumbs up coming here. So that's great. All right, next slide. So I want to talk about how the dietary guidelines are developed. I'm going to talk about historically how they've been how they've worked, and then what happened differently this cycle. So historically, an expert panel reviews the science. They take about 2 years to review all of that science. This group is called the Dietary Guidelines Advisory Committee. And they put together a report, and this is sent to the Department of Health and Human Services and the USDA, who then will finalize and publish the dietary guidelines. Moving forward in this presentation, I might refer to the dietary guidelines as DGAs. Just want to make sure that you know those are the same things. So in this cycle, a advisory committee was formed in 2022. This was under the Biden administration. They took 2 years to do all of their research, and they submitted their report for review in 2024 to the federal government. And kind of in an unprecedented move, in 2025, HHS decided they were going to develop a completely separate committee to develop the dietary guidelines. So they looked at the report, the original report that was given, and they had put forth 56 recommendations. This new committee rejected 54% of their recommendations. They accepted or partially accepted 46% of those recommendations. You may have heard some information in the media about the makeup of this 2025 committee. About 44% of the people on that committee have ties to the meat and dairy industry. And we do see a theme in the recommendations that were rejected, had a lot to do with promoting the consumption of plant-based foods and limiting red meat and high saturated fat animal products. So there's been some concern from the public about these ties, but I will say that unfortunately, this is not a new problem. A lot of the advisory committees tend to have membership that is linked to the industry. So I think as we go through the guidelines, we just want to use like a critical eye to see if we can see the industry influence on the recommendations that were provided. Next slide. So one of the main reasons why the 2024 Advisory Committee report was not fully adopted was because it was written through a health equity lens. And this 2025 committee was not concerned about using a health equity lens. So I'm going to read you a quote here that's coming directly from the scientific report from our new guidelines. The central concern with the DGAC report was that all scientific questions were evaluated through a health equity lens, obligating reviewers to filter evidence through considerations of race, ethnicity, culture, and socioeconomic status. So clearly, this was not a priority for the 2025 committee. And I think as community members who are doing work in food security, food equity, food justice, we can all appreciate how important a health equity lens is to the work that we do in Montgomery County. So really, the reality is that a health equity lens is critical when establishing DGAs because it helps us to understand why people make the food choices that they make. And without a health equity lens, the results are guidelines that are maybe not applicable or practical for all people. I also just wanted to highlight that the work that we do on the Food Council, everything that we do is gone through an equity lens. And I just wanted to read a piece of our equity statement, and that is that meaningful change begins with dismantling structural barriers built into our food system. So as a dietitian, as a council member, the lack of a health equity focus in these DGAs is challenging for me. If you agree, you can give me a thumbs up. All right. Yes, I see lots of thumbs ups. Okay, next slide, please. All right, I just want us to walk through what the last 3 decades of food graphics has looked like, just so we have some context for what we're facing right now. So we have gone from the classic pyramid. This was from 1995 to 2005. Many of you probably remember this pyramid. This is the pyramid that I was taught when I was going through school. You can see that at the base of the pyramid is the grains, and as we move up to the tip of the pyramid, it's recommending to limit like oils and sugars and so on. We then went to the rainbow pyramid. They added an emphasis on physical activity. And for the last 15 years, since 2010, we have been using what's called MyPlate. I'm sure many of you are familiar with MyPlate, with the main messaging being make half of your plate fruits and vegetables and about a quarter of your plate protein and grains with some dairy on the side. And now we have our upside down inverted pyramid. One of the big changes is that we're down to 3 food groups. So I think we don't eat in a pyramid format, we eat in a plate format. So I felt like we were in a good place with my plate, but now we're going back to a pyramid. So let's do a vote in the chat. Which graphic do you think is easiest for the average person to use when planning a meal? 1, 2, 3, or 4? Okay, I see all threes. Thank you. All right. So I think all these answers are showing that communication tools matter. And when we have simple nutrition or simple graphics to go along with the DGAs, it really helps to make sense of the nutrition guidance. Next slide. All right, so let's take a look at the key messages that are coming from the new DGAs. So we'll just go through these. Eat the right amount for you. Prioritize protein at every meal. Consume dairy. Eat vegetables and fruits throughout the day. Incorporate healthy fats. Focus on whole grains. Limit highly processed foods, added sugars, and refined carbohydrates. And limit alcoholic beverages. So I really like the simplicity of these messages. I think most people can get behind this type of messaging. I don't think these messages are actually controversial. I think the controversy has lied in the actual graphic. So I don't know that the key messages align with the actual graphic. So when you look at this upside down pyramid, you're going to notice that certain foods are going to rise to the top, certain foods are going to fall to the bottom. So just in the chat, if you could put what foods are you visually seeing that have all of a sudden risen to the top? All right, I'm seeing steak, red meat, proteins, meats. Okay. So everybody's seeing the same thing. Lorian says, have some steak. So I think this is a good example. So we've got in this section, this new protein section, there's 15 foods in that section. 12 of those foods are animal products. 3 of those foods are plant-based products. So I think that we're seeing it's a little bit heavy in that area. All right, next slide. All right, so we're just going to go through the new messaging for each of those areas that have changed. So let's look at the new messaging for fats. I've highlighted the changes. So the messaging is incorporate healthy fats from whole foods, such as meats, poultries, eggs, seafood, nuts, seeds, full fat dairy, olives, avocado, butter, and beef tallow. Consume full fat dairy with no added sugar, and keep saturated fat consumption not more than 10% of calories. So this 10% saturated fat limit has remained unchanged. This is what it's been. It's consistent with current evidence-based recommendations. What's changed now is this new emphasis on full fat dairy and like higher fat animal products. And because of that, it's going to be really hard to maintain a 10% limit. So I'm going to give you an example. For somebody who's on a 2,000 calorie diet, a 10% saturated fat limit is going to be 22 grams a day. If you were to follow the new guidelines and you have 3 cups of full fat dairy, 1 tablespoon of butter, and you cook a 4-ounce steak in some beef tallow, you're at 33 grams. So I think that the guidance around fat consumption is it's challenging. I think it's going to be really hard if you're changing this. And, I think the messaging even in the pyramid is that, butter is highlighted, the steak is highlighted, and so on. If most people are going to be looking at the graphic, most people are not going to be looking at the guidance. So if we just look at the graphic and we think, oh, I can have all of these things now, it's going to be impossible to stay in that 10% limit. Okay, new messaging for protein is to prioritize protein at every meal, consume a variety of protein from animal sources and plant sources, and aim for protein consumption of 1.2 to 1.6 grams of kilogram per body weight per day. This is a pretty big change as far as the amount of protein that's being recommended. So currently, the recommendation, kind of the minimum protein that somebody needs per day is 0.8 grams per kilogram. So this doubles that. And I think it is time that it's been increased because I think that 0.8 grams is very low. I think the 1.2 to 1.6 grams may be a little on the high side, but I am glad to see that we finally have some movement upward in that. And again, with the graphic, while plant sources are listed for protein in the graphic, it's literally like 6 nuts, and everything else is an animal protein. So I'm seeing a little bit of influence there. All right, next slide. Okay, the next major update is surrounding processed foods, with the messaging of avoid foods that are highly processed, packaged, or ready to eat, and other foods that are salty or sweet. So we know that currently processed foods represent 60 to 70% of the food supply. And we know that processed foods are associated with poor health outcomes. So whereas previous DGAs were like all foods can fit in an overall healthy eating pattern, we're seeing some really some stronger language now. So it's not like limit processed foods. The language is now avoid processed foods. And one of the challenging things with processed foods is that we don't have a very good definition of what processed foods mean. We're currently using something called the NOVA food classification system, but they literally only consider how something is processed and not the nutritional value of those foods. And because of that, you can have a healthy food and a not so healthy food in the same category. So, for example, instant oatmeal is going to be in the same category as an iced oatmeal cookie. And I think we can, intellectually look at that and know that having some oatmeal is going to be a better choice than an iced oatmeal cookie. And other things that fall into this highly processed food category are things like fortified soy milk, fortified high fiber, low sugar cereal, flavored yogurts. So I think that it's time for the industry to have a better working definition of what processed food is. And thankfully, the FDA I think just this week announced that by the end of the year, they're hoping to have a federal government definition of ultra processed food. And practically what that means is that without a good working definition of what processed food is, it's hard to change the guidance for any nutrition programs like school lunch programs. Like we have to have a good definition in order to make those changes. All right, major updates with sugar. Avoid sugar sweetened beverages, limit added sugars to no more than 10 grams per meal, and no added sugar from birth to age 10. So this is where the language has changed. Previous DGAs have discouraged sugar-sweetened beverages. Now the language is stronger. It's avoid sugar-sweetened beverages. Previous guidelines recommended no more than 10% of calories come from added sugar. Now they've changed it to like a per meal limit. And I don't know what to tell you about this last recommendation, no added sugar from birth to age 10 years old. It's very impractical. And I guess we can't have birthday cakes when we're celebrating our kids' birthdays. I guess that's the message. All right, next slide. All right, new messaging with carbohydrates is to prioritize fiber-rich whole grains, and the number of servings have decreased down to 2 to 4 servings per day, and significantly reduce highly processed refined carbohydrates. So I think these are great messages, and I think this is another example of where the graphic doesn't match. So from the graphic, and since grains are in the very bottom point, it almost feels like those are demonized. But when you read the guidance is actually fine. Okay, another major update is for food additives. This is the first time food additives have been in any DGAs, and they're recommending a limit to foods that have artificial flavors, dyes, preservatives, and non-nutritive sweeteners. I think it's interesting that it's not surprising that they're in there. I think it's interesting that they're in there because the research is not fully overwhelming that these are all bad things. There's certainly evidence out there that they could affect child behavior and the gut microbiome, but it's like the research doesn't fully weigh it out at this point. Okay, next slide. Our last major update that we're going to talk about is alcohol. So their messaging is consume less alcohol for better health. Previous DGAs actually had a limit on how much alcohol, which was 2 drinks a day for men and 1 drink a day for women. So they've really like softened their approach to alcohol, and I think that's interesting because even in the Surgeon General in the last couple of years had come out with a report on alcohol as a proven carcinogen. It's one of the leading preventable causes of several types of cancer. So I think it's interesting that that approach was softened. So I guess it's okay for you to have some alcohol, but you definitely can't have that birthday cake. And then I don't know if you guys saw Dr. Oz, who was the head of CMS, was being interviewed and asked why there was a different approach to alcohol. And his quote was pretty unbelievable. He said that alcohol is a social lubricant. It leads to having a good time with friends, which is good for one's mental health. And I think that this is just really poor messaging around alcohol because we don't need alcohol to hang out with friends. We don't need alcohol to have a good time, especially when we know um, the health issues with alcohol. So react with an emoji for me if like to show me how you feel about kind of these guidelines that we have just gone through. I see lots of surprises. All right. So let's go to the next slide. Let's get into the implications for federally funded nutrition programs. So here's where we kind of get into the nitty-gritty. I think that it usually takes several years for the actual nutrition guidance for these federally funded programs to catch up with the DGAs. I have heard like senior government officials have said that they're planning on moving pretty quickly with these changes, but I think that we're going to see an allowance for more animal protein and whole milk products. Um, and you might wonder how they're going to get around that 10% saturated fat limit. There was a law that just was enacted called the Whole Milk for Healthy Kids Act that allows schools to serve whole milk alongside their other milk offerings, but they don't have to count the saturated fat in that whole milk towards the overall daily limit. So I think there's going to be ways that they can get around these things. But I think for sure, schools and other programs are going to have to rely less on processed food and more on scratch cooking. I think there's going to be limitations on sugar, especially for that under 10 age group. And I think we'll probably see no refined grains. So I think these could have some really good impacts. I'm excited to see what these impacts will be, but I think that there are some serious questions like, is the infrastructure in place? Is the funding in place? I think key stakeholders have already talked about concerns with staffing, equipment, the reimbursement. So our current reimbursement rate for free lunch is $4.01. So can we completely overhaul the way our menus are made and our food is served when the reimbursement is $4.01? So yeah, I think that we will need to kind of see what happens. Next slide. I think that the things that will help immensely to make this successful is pretty straightforward. I think that the meal reimbursements need to increase. Free lunch for all students would be amazing. And I think that we're going to need culinary training, increased staff, better equipment, and some farm to school grants. Next slide. So I would be remiss if I didn't touch on the environmental impacts of the current DGAs. That are definitely putting more of an emphasis on animal and dairy. We know that animal farming has significant environmental effects, major driver of greenhouse gas emissions, increased deforestation, uses substantial land and freshwater resources. And I think if you were to look at, like, for example, the Eat Lancet planetary health diet, while it doesn't do away with animal products or dairy, it just puts more of an emphasis on a plant-forward diet because that is better for our climate. Okay, Heather's asking, are there any distinctions between recommendations and requirements, particularly as they will apply to impacted federally funded programs? So it, it's interesting in the guidelines, it has to be very specific in order for the changes to happen with the federally funded nutrition programs. So I didn't touch on it in one of my slides under processed foods. It says avoid foods that are sweet and salty. That is so vague that that will never make it into nutrition guidance in like school nutrition programs. But something very specific, like a 10% saturated fat limit, or for added sugars, no more than 10 grams per meal, that's very specific. And so I think that will impact what is on the menu. So that's a good question. All right. Next slide. So actually, next slide. So kind of as a summary, I want to just talk about what did they get right and what did they get wrong. What did they get right? I do really like the simplified messaging in the written guidance, not the graphic, but the written guidance. I like their messaging on protein at every meal. It supports fiber through fruits and vegetables and whole grains. It discourages highly processed foods. Um, it discourages added sugars and focuses on real food. Um, yes, you can do the next slide, and then I realized I skipped a slide. So let's do the next slide. What did they get wrong? So my biggest concern on what they got wrong was the discarding the health equity lens. I think that's pretty significant. I don't think the graphic matches the written guidance. There's lack of cultural considerations. We've got the promotion of animal, dairy, and saturated fat when they're not emphasizing plant proteins. I really don't like the messaging surrounding alcohol. They really did miss the mark on environmental considerations. I actually thought that the new DGAs would address environment. It's not in there at all. And I don't think that the recommendations are supported by all of the recent cuts that we've had to SNAP and SNAP-Ed and so on. So if you could go back 3 slides, the title is Will the Dietary Guidelines Make America Healthy Again? All right. So the message of the DGAs is to eat real food with a goal to make America healthy again. And I would ask, what Americans are they focusing on? Because if the focus is on all Americans, why are they cutting funding for these essential programs like SNAP and SNAP-Ed and WIC that are providing critical support to low-income Americans? And I think by cutting this funding for all of these programs, but telling Americans to eat real food, it really feels like that these DGAs are only for certain Americans who can afford to eat this way. So I fully can get behind a message of eat real food. And I think we need to back it up with realistic ways to make that true for all Americans by changing our food environment, by changing our policies. So the DGAs are not what has caused nutrition-related chronic disease or obesity or cancer. That historically, Americans are not even reaching the recommendations of DGAs. But what has made America less healthy is our food environment. where 70% of our food supply is ultra processed. We have food deserts, food swamps, aggressive food industry marketing, cuts to food access programs. So I would like to see that these are DGAs that all Americans can access and enjoy. All right, if you could skip down now to one more and the last one. Okay. So if you were curious what the dietary guidelines would have looked like if it was based on the original report from the advisory committee from 2024, the Center for Science in the Public Interest has put together a great resource called the Uncompromised Dietary Guidelines for Americans. It's based on that report. So I would recommend anybody to Google the Uncompromised Dietary Guidelines for Americans and see what it could have been. The next two slides are my references, and I would be happy to take any questions at this time.
While people are collecting their thoughts, I just wanted to thank you so much, Jennifer. That was an incredible presentation. You really covered, just the key points. Congrats on such a difficult subject, to cover that so clearly and concisely and in ways that we can all understand and relate to. Does anyone have any specific questions for Jenny? Okay. So AK is asking, what happens when schools, for example, fall short of the DGAs or cannot make the infrastructure shifts needed to adhere to the guidelines? Are there repercussions? Yeah,
I think somebody's going to be talking from MCPS. Okay, I'll
yeah.
just say, so my program uses the Child and Adult Care Food Program, and they will come and audit us. And if we're not following the guidelines, then we lose reimbursement. So let's say that they, came on a day that for some reason we didn't offer milk or we, missed a whole grain, then we would lose the reimbursement for that entire day. So yes, there's pretty big impacts for not following that, but I think that MCPS can better talk to school lunch. How will this impact food banks, food assistance providers? So I think that maybe as we see a shift in defining ultra-processed foods, I think that we may see some benefits to food banks and food assistance providers. That I think it almost puts the industry on notice that these are foods that are not supported by the DGAs, they're not supported by the government, and so maybe they will start to shift what they're providing.
Yeah, and we've seen similar changes like that in the past, as there have been adjustments to sodium levels. Once they were going to add added sugars to the nutrition fact labels, there were a number of products that started, shifting the way they produce these products to, avoid having to show how much had been in it originally. So yes, Jennifer's right. There's definitely an industry response, as they're able to do to make those products more appealing.
Well, and I think especially even with what's provided to schools, is
Yeah.
that there's specially formulated products that are available to schools to fall into the, specific criteria. Okay, Angela's asking, is it standard to have a large contingent of the food industry be part of the committee that makes these DGAs? Yeah, that's what I was talking about in the beginning. When it first came out, this 9-member committee that was selected kind of off the cuff, and you could see like significant meat and dairy industry. I went back to the original 2024 committee to see what were their ties, and it wasn't clear. They didn't have it broken down as clearly. So it had a list of all of the ties, but not like who was a tied to which industry. But so even in that 2024 report, there is still ties to the industry, unfortunately. I think that's been pretty common.
I'm going to ask if you have any other questions to please add them to the chat. And Jennifer's not going anywhere. She can answer them in the chat. It's just we do have two other presentations that I want to make sure we have time for, and that also may address some of the questions that you have. So I'm going to turn things over to one of our new Food Council members, Erica Walther, from MCPS's Department of Food and Nutrition Services, to give us a sense of, just like what Jenny was saying, kind of what happens as these guidelines roll down into the community and into different federal nutrition benefit programs. So thanks so much for joining us, Erica.
Yeah, thanks for having me. Can you guys see my screen? You're good. Okay. All right. So I was asked to talk a little bit about school meals and the dietary guidelines. So how are the DGAs and any changes that are happening going to affect school meals and sort of locally what's going on in Montgomery County Public Schools? So we will talk about sort of just a brief overview of school meals for anyone who's new to this topic. We'll talk about how the DGAs are going to affect the school meals. And sort of what are we at DFNS doing to address cultural preferences, dietary restrictions, and then plenty of time for questions and answers. So let's start with an overview of school meals. I love this picture because it's from a back to school night. So during back to school night season, we go out to schools where they're having a little bit more tabling going on, and we'll put out sort of like examples of what we have for breakfast and what we have for lunch. And so parents really get an opportunity to see what the students have available to them at school. And it's really fun. We get a lot of really good questions. So what guides our school menu? We have a couple different pieces that go into it. The two big ones are what we call meal patterns and dietary specifications. So meal patterns are written by the USDA. They have 5 meal components. So we talk about milk, fruits, vegetables, grains, and then we call them meat or meat alternates, also known as proteins. The meal patterns tell us how much of each of those items need to be served in ounce equivalents or cup equivalents at each meal, so at breakfast and lunch, and then also for the snack and supper program in the evenings. And that will vary by grade group. So typically grade groups are broken K through 5, 6 through 8, and 9 through 12. And then USDA does have special meal patterns for schools that might have mixed grades and don't exactly line up with those meal pattern grade groups. The dietary specifications are ranges for our nutrients that you would see on a nutrition facts label. So we cover calories, we cover saturated fat, we cover added sugar and sodium now as well. And I'll give you a look into what some of these are in a minute. The other piece that we are really tied to is what's called vegetable subgroups. So within the vegetable meal component, we break it down into 6 different subgroups, and each week we're required to serve minimum portion sizing of each of these. As you can imagine, what works on a school lunch menu and what works with kids in these groupings can be a really fun challenge. So you see a lot of baby carrots and grape tomatoes at schools, and this is one of the reasons, because they're a really easy red-orange vegetable. You'll see sweet potatoes, dark green, and leafy is really where that comes from. We see a lot of broccoli, we see a lot of salads, beans, peas, and lentils. So while those count as proteins as well, you do have to serve a half a cup of them every week to count towards your vegetable subgroup. So at MCPS, you'll see roasted chickpeas that sort of come in like an individual size bag, and those count as a vegetable. But then we also have entrees that include chickpeas where we are counting it as a meat or a meat alternate, and we can't double count it as a vegetable too. So this is an example of what the meal pattern looks like for lunch or for breakfast, excuse me. So you'll see in the rows, it's going to break it out by meal component, and in the columns, it's going to break it out by grade group. And the number in the parentheses is your minimum per day, and then this is reported across the week. So a lot of what's happening on the menus at lunch and breakfast are averaged over the course of the week, or we have to have 9, you'll see under the grains and meat alternates for breakfast, there's a range. So they want us to hit 8 to 10 over the course of the week with a minimum of one per day. So we might have one day where there's a one grain breakfast, but most days you're going to see two or more because we need that to meet the requirements. This is an example of what it looks like for lunch, and you'll see the vegetable subgroups on this one are more filled out. So this is what we have to serve per week. And if there is a minimum portion sizing for day, it's in the parentheses. I think the interesting ones to look at are like the portion sizing for milk is the same. It's 1 cup for all grade groups. But if you look at your fruit, if you look at your vegetables, if you look at your meat alternates and your grains, they're all going to increase as the kids get older to adjust for calorie needs as those students grow. For those who really like to get into the weeds, you'll see that 10% for saturated fat comes up again in school meals. So the recommendation is less than 10% of calories from saturated fat. For calories for breakfast and lunch, the same thing. They're reported in a range per day so that we can average out over the course of the week. And they will increase as the students get older. So you'll see that they do get higher. It does get challenging sometimes to either get to that product because of the other limitations, and we'll talk about sodium in a minute. Or it can get challenging in some instances to stay under 850 for products. We hear a lot from older students that they're hungry at lunch, and so really finding meals that we can provide that are filling but stay within the calorie ranges is also always a fun puzzle to look for. So added sugar is relatively new in the school meal program in terms of having limitations and really being able to track it. USDA put out some proposed rules a number of years ago. They accepted public comment for a while. They came out with then a final rule, and they provided a tiered approach to limiting added sugar in the school meals. Jennifer touched on this a little bit about industry having to get us to where we need to be. School meals rely a lot on products that are purchased, whether those are what we would call speed scratch, where we're buying sort of partially pre-made item and turning it into a meal, or we are buying a full pre-made item and serving it as well. But you'll see added sugar. These are the current requirements where we are in school year 25-26. So our breakfast cereals have to have less than 6 grams per ounce. Yogurt must have less than 12 grams per 6 ounce. That's really challenging to meet. I would just encourage you, if you're at home, to look at any flavored yogurt you have, or the next time you're at the grocery store, pick your favorite one that's a flavored yogurt. And it can be challenging to meet the yogurt because most of the yogurt in the industry and the market is pretty flavored. And then the flavored milk for those who serve it as well too is on there. By school year 27-28, it's going to change to 10% of total calories for breakfast and lunch over the course of the week, similar to saturated fat. And so, not only do we need to change how we're looking at that and how we're calculating it, we have nutrition programs like computer software that does this with us. And so all that software is going to have to update how it reports out information, how it's collecting information. And I imagine that those companies right now are feverishly working to get there so that they can release updates for everybody who uses them. Sodium. So originally, in 2022, there was a step-by-step approach to reduce sodium in the school meal programs. In 2024, they amended the rule because the original targets were unattainable based on products available in the market. And I think that was a really good example of sometimes not everybody is included. Somebody asked a really good question about is it standard to have large contingent of food industry be part of the committee that makes the DGAs? It is really important to have a lot of people at the table when guidelines for school meals and the DGAs are going to inform school meals. So it's important to have them at the table because for industry to reformulate all of their products to be able to meet the school meal needs can take a long time. And we'll talk about some of the things that are currently happening and we're seeing at our school meals here in Montgomery County too. These are the sodium limits, sort of where we are now and then where the targets are for 27 and 28. And so we are close to having to step down, to this sort of final place for sodium. And so as we redo our menus here at MCPS, it's a big part of our conversation, for sure. Whole grains are another big part. So at least 80% of the grains that we serve to students have to be what's called whole grain rich. And whole grain rich means that more than 51% of the product is made with whole grains. The remaining grains can be enriched, but it really does mean that we're limited. So things like pasta, things like rice, bread, wraps, cereals, anything that comes in a pre-made item for us, pizza crust, all that stuff. While it might not look it to the eye, we meet that requirement for 80%. So, and I can tell you for us, like we purchase a non-whole grain noodle for our macaroni and cheese because the whole grain ones, when we were working on that recipe, just didn't work. But that's basically the flexibility that we have with the size of our meal program and the amount of mac and cheese that we make in-house from scratch. Everything else you see in our meal programs is mostly would fall into that category of whole grain, which we may have one or two products here and there that get subbed in. Any questions on school meals in general before I move to the piece where they go to the DGAs? I know we're going to do Q&A at the end, but if there's like a burning question that you're concerning about and you want to put it in the chat. Yeah, so Patricia, we're going to talk a little bit about dietary accommodations and how we work with those students. So that's a great point to say that if people have kidney concerns, that can be challenging. I will talk at the end about how we handle those students as well. All right, I'll keep an eye on the chat. School meals and the dietary guidelines. So like Jennifer said, the school meals are going to adjust to the dietary guidelines. Timeline on that is TBD. I would imagine with this administration, things seem to be moving a little quicker. While I hope it would take a while, I think we're probably looking at proposed rulemaking releasing sometime in the next couple months. But that will go through comment periods. So what'll happen is they'll release a proposed rule. It'll be open for public comment for a certain amount of time. And then the USDA will take that and they will review all of the comments. They'll have to put a report out on what they got. And then they will have to release a final rule. And typically when they release a final rule, there is a little bit of lag time in order for programs to get to there. And depending on what they change, I imagine those added sugar requirements might get a little stricter. I imagine there may be some regulation around food dye, additives, things like that. We are already exempt from the whole milk being counted towards the 10% of saturated fat, similar to how it's being brought up as an issue with the DGAs. They did recognize it as an issue in school meals. And so when they released the Whole Milk for Healthy Kids Act, it does say you don't have to count milk towards your 10% limit on saturated fat. But I imagine we're going to see some changes that will come up to both the meal pattern and to the dietary specifications, and then potentially above and beyond that on things that we've never seen before, like ingredient selection. The flexibility and for allowable milk with the Whole Milk for Healthy Kids Act, that just came out very quickly, more quickly than anybody anticipated. So this is a breakdown of sort of the pieces that are really applicable and important for us. So whole and 2% milk can be offered, but it's not required. So we are not required to make changes. It just allows a flexibility in the current regulations. It does allow us to offer soy milk to all students as long as it's nutritionally equivalent, which is different than previously. So we had to have a written medical statement or a request from a parent to have soy milk before, and now we can make it widely available to any student. And the soy milk that we have is meeting the nutritional requirements for it to be available. So that's really nice for us. That's a plus. Like I said, the milk is excluded from the weekly limit on saturated fat. Anything related to disability reasons can be submitted by a parent or a guardian. So they've rolled back the requirement for having milk disability things being submitted by a medical professional or a registered dietitian. What is important is that this was written in a way that it only applies to school lunch right now. It does not apply to school breakfast. It does not apply to snack or supper or anything under CACFD. And so there are positives and negatives to that. The positive is that if there was anything very restrictive in here, we're only limited it to lunch. But from an operational standpoint, for schools that are going to choose to serve whole milk, having to not serve it at breakfast but make it available at lunch is operationally challenging. Just not the most well thought out piece of legislation. And my guess is that was an oversight by whoever wrote it. I don't think it was intentional, but that's just an opinion. Okay, the reduction in ultra processed foods and artificial additives. So the DGAs very clearly talk about processed food, food dyes, sort of what our food system is made of. And like we heard, there is no definition on what processed foods mean. All that needs to be worked out before it can get to the school meal program. My best guess is there will be something having to do with that released when they do make changes to the school meals reflecting the DGAs. But for what's helpful for right now, this is a list of the things that MCPS already prohibits. We've done this for a number of years. Anything you see in our meal program will not have any of the items listed. So no artificial colors and dyes. You won't see any aspartame. You won't see any MSG, no artificial trans fat. Some of the other things in here are sweeteners. They are rising agents in baked products that are banned in Europe. And this is not, we talk a lot about when do we expand this list? How do we change this list? This is the one that we've been working off of. So we'll always take information and comments if anyone has comments. But I think what's really important to understand is that if you're a parent of an MCPS student and like me, you clean their backpack at hopefully every night. Sometimes it's not every night, but I try and get there. You're going to pull out a snack wrapper of something they might have purchased at lunch, a la carte. And you might see a bag of right now wild white nachos or Doritos, wild white Doritos. And we'll get emails from parents that say like, I can't believe you're serving your Doritos to our kids. And what's important to understand is that if you flip that bag over and you compare it to what you could get at like the grocery store, it's a different ingredient list. And the packaging looks very similar, but they are Doritos specifically made for K-12. They have no MSG. They have no artificial dyes and colors. And companies are continually evolving products that they are only making available to the school meal programs because of the restrictions. They're lower in sodium. They're richer in whole grains. They can be lower in added sugar. We don't use them here, but other districts I've worked with before, there's like an entire line of sugary cereal that's made with 30 to 50% less added sugar. And the packaging looks mostly the same, but they're specifically designed for school meals. So you'll see kids who are eating Cinnamon Toast Crunch for breakfast, but it is not the Cinnamon Toast Crunch that you're seeing at school. So we really just encourage parents to look at the labels, to ask questions, to talk with their kids about what they can and cannot be eating. But we really try to sort of start with a solid baseline and make sure we're on track with that. So the hope would be that if they do make any changes to processed food or additives, that we're at least a little bit ahead of the game and ready to go. Okay, so then a quick discussion on school meals for student needs. If you are not familiar, we have this tool called Meal Viewer. Meal Viewer is our online hub for menus. This is just a couple examples of what we put the school logos and you find your school logo, you click on it, and then it pulls up your menu and you can see what's available that day. You can see what's available for the next 1 to 2 weeks. There's photos if you hover over, you can sort by allergens and things like that. I can pull up the page here. So I'm going to do Ashburton because it's here. Can you guys still see this? Yeah, okay, great. So we had some snow days. So it takes us about a week and a half to recover in terms of where our menus shift. So we put a little banner up here. But you can toggle between breakfast and lunch. If you hover over a menu item, it'll show you a picture. It'll show you nutritionals. It'll show you what allergens it has of the 9 major allergens. And if you are a parent or guardian of a student with allergies, one of my favorite things that you can do is come over here and you can select the allergen. And then Meal Viewer will go through and cross out all the items you can't eat because they have that allergen in them. And so it makes menu planning really easy for families who have the luxury of choosing whether they participate in school lunch or not. They can see that, for a student with an egg allergy next week, Wednesday and Friday are not great. but Monday, Tuesday, Thursday, totally safe, whatever they choose. So it's a really nice tool to be able to use. And then there's printable versions that you can print out with your students. And we do have also, if you are a parent or a school nurse and you're working with students with diabetes and carb counting, we do have a tool that they can use in here that talks about looking at the carb counting and helping the nurses figure that out. So they can go through and select the menu item. They can say, did they eat, the whole portion? Did they eat half a portion, a 3/4 of a portion? And it'll help them make estimations on the carb count so they can administer the right amount of insulin for them. So we love Meal Viewer. We always want to spread the word about Meal Viewer. It's a great and fantastic tool. So we had a question a little bit about the kidney concerns with whole grains, so dietary accommodations. So any student who would like to participate in the school meal program and has a restriction for eating, whether it's allergies, disease states, feeding issues, we have a form. It's called a dietary accommodation form. A parent or guardian fills it out. It gets signed by a health professional, whether that's a nurse, a doctor, or dietitian. And then we will work with that family to develop a menu that works for that student. So sometimes that means just making sure that there is always certain menu items available at their school that they can be served that's off the menu. And sometimes that's a little more tailored, like we're putting their food in a blender and making sure that they can eat it in a way that works for them. So we really encourage families who do have students who need a little bit of support in terms of the feeding side to get in touch with us and fill out that form. And then generally, we're always expanding our allergen-friendly meals. Our procurement strategies are underway to add more gluten-free, more soy-free menu items to our standard menu so that for students who are gluten-free or students who are allergic to soy, they don't have to have a special menu. They'd just be able to eat more frequently from our regular menu. It makes it easier on us. It also makes it way better for the student because they're not being singled out with a special meal. And we know for some students that can just be sort of another layer to a situation that they're already dealing with. So cultural preferences, we really are trying to create menus that reflect our ever-changing student body. We spend a lot of time getting student feedback. We had a couple folks from this call at our annual Taste of MCPS event on Friday, where we sampled over 20 different recipes and snacks that are coming from either new concepts that we're working on or concepts that our vendors are developing. And we have the students taste them, vote on them, let us know what they like, what they don't like, if it should be more salty, less salty, hotter, colder, more vegetables, less vegetables, whatever they want. And then we really use that information to tailor our menus and make changes. So couple of things that we've changed recently is we have chicken and chickpea tikka masala on the menu. We have pupusas with curtidos and plantains on the menu. We have ramen noodle soup and empanadas in the works right now that we're hoping to release next year. And then for religious accommodations, we have heard some requests for halal certified proteins in certain areas of the county. So we are exploring what that would look like. And we always try and keep Meal Viewer updated so families can see what foods work for them. They get in touch with us if they have any questions about, ingredients or things like that, if there's certain ingredients that they don't consume for religious reasons. That's it. I'm going to take questions. I see that there's two in the chat. So do you think companies would make healthier alternatives available for other organizations? It's a good question. I think probably yes, if asked, if you ask the right questions, right? So like if you approach a big food company that you see somewhere and let them know that you would be interested in purchasing the items that they're making available for schools specifically, I would think it would be okay. They're already making the product and higher volume is always better for them. But I don't think they're going to advertise it out, but really asking the questions about, do you have K-12 product that we could have access to would be the way to do that. How can students sign up for feedback groups and programs? So it's really about, let's see. So for the Taste of event at our school, we sort of do it in a number of ways. We select different schools every year. So we try and cycle through and change it up every year. If there's like a group of interested students at a school, they can get in touch with us. They can have my email. They can always email DFNS office. I can put it in the chat. and let us know that they have questions about the school meal program or they want someone to come talk to their classroom, and we will do our best to accommodate. We have a number of folks on staff who sort of deal with wellness, community engagement. We have our school-based team who is out in the field every day, handling anything that's happening at a school. And so we can connect to students in that way. And then we always take feedback over email. And then the other piece is that the student member of the board, Anuva, she really talks a lot about school meals with kids, and so they can always get in touch with her and see if she's doing any engagement with anyone at the time as well.
I'm gonna just a note, we're at 2:15 and I want to make sure that we have time for our last presenter. But Erica, thank you so much. That was incredible. I was able to come on Friday to see the Taste of MCPS. It's always one of my favorite events. Kids have lots of opinions and have no problem sharing them. So it's just a wonderful opportunity. But please, again, if you have any other questions for Erica or even for Jenny, please put them in the chat and we will just move on to Kaamilah from the Capital Area Food Bank to kind of help, what do food assistance providers do with all of this information? How can you make sure that if you want to have and maintain, a healthy pantry, what are ways that you can do that regardless of what guidelines are coming down? So Kaamilah, I'll turn it over to you.
Yes, okay, I'll go ahead and share. Okay. Can everyone see that? Just a quick thumbs up. Okay. So my name is Kaamilah. I'm the nutrition education specialist here at the Capital Area Food Bank. And I'm just going to be sharing some nutrition education resources that we have. So the goal of the food bank is to improve the health by providing education and resources that promote food growing and reducing food waste, and also increasing the consumption of nutrient-rich foods that CAFB supplies to the community across the DMV. So one of the many ways we do this is by providing recipe cards. So we create recipes here at the food bank that takes common food bank ingredients and ingredients that a lot of our clients or neighbors may find in their home, and we create healthy, nutritious recipes that anybody can make. So none of them include like very hard to find ingredients or maybe some tools that you may have. So we'll never have like maybe lemongrass in a recipe, or we'll never have like an immersion blender used in our recipe. So it's very level across the board, and any of our clients and neighbors can use them. We also supply a produce guide. So maybe if you're having like a farmer's market, or if you're getting some produce in that some of your clients or neighbors may not be familiar with, we have produce guides that tell you how to store them, different ways to prepare them, a little quick recipe, and also how they're good for you and how you can use them in your everyday cooking. And then we also provide 7 ways cards. So sometimes you'll get a produce in or an ingredient in that you kind of use one way, but how can we use that one ingredient or that one produce in 7 different ways? So for example, we have like a 7 ways to use brown rice. And the ultimate way, we're just going to cook it on the stovetop and serve it as like our whole grain on the side. But how can we use that brown rice in 7 different ways? So you can maybe add it to your soups to like bulk it up a little bit, or you can add them to your meatballs to like make them as a binder. So it's using the things we have in a variety of different ways, so they're not, not going stale or you're getting like tired of them. We also make culturally familiar recipes so that we recognize that the DMV is not a monolith and we represent a whole bunch of different cultures. And so we try to make recipes that are representative of all of them. So we have some East Asian recipes, some Middle Eastern recipes. We have a couple Indian recipes, Latin American recipes, to make sure that we're representing all of the groups across the DMV, and all of our recipes come in 7 languages. So our printed recipes actually come in English on the front, Spanish on the back, and then online, we have 7 different languages available. So Vietnamese, French, Arabic, Amharic, Farsi, and Pashto are all available online. So where can you find these resources? So if you go to capitalareafoodbank.org and click on what we do, and then under nutrition and wellness, you'll find our recipes, produce guides, and 7 ways cards. And they're available to download for free. And like I said, there are 7 different languages online, but our printed versions come in English and Spanish. So we also have nutrition cards available. So we have how to read the nutrition facts panel, build balancing your plate with my plate, and healthy eating on a budget. So if your clients or neighbors are ever interested in saying like, how do I build a healthy plate? You can give them this My Plate card, and it kind of takes you through all of the different sections on My Plate and how to build a healthy plate. Also, eating healthy on the budget, some little tips and tricks of stretching your food dollars, and then also how to read a nutrition facts panel. And those are available for print and will be up on the website soon, hopefully. We also have a food coding guide that is very popular. So oftentimes we'll look at the best by date or the use by date, and we'll kind of maybe throw those things away because we automatically assume that they're not good anymore or they're not safe to consume. But a lot of the times, the best by dates or the use by dates are just general guidelines that the manufacturers put on there, that they say that they can't guarantee the freshness after this best by date, but the food is still really good. So we have this food coding guide that goes through canned goods, some dry goods, dairy, produce, eggs, and some bread and bakery that gives you some guidance on when is it actually safe to eat or when you should actually throw it away. Because again, we want to encourage our clients and neighbors to kind of stretch those food dollars and to reduce that food waste. So if we can use something past its best by date or use by date and it's still perfectly healthy and nutritious, we should just still go ahead and do that. We also have a recipe video library. So if you type in Capital Area Food Bank on YouTube, we have some recipe videos that kind of takes you through some of our recipes. We recently uploaded a recipe video on egg drop soup. We also have one up there for carrot, I think it's like egg roll in the bowl or something like that, but it kind of walks you through how to make some of our more complicated recipes and just kind of shows you different ways you can use your produce at home. We also have a Ask the Nutritionist line. So if you guys have any questions or maybe how do I use this avocado that I just got, you can dial us up and we can just have a quick chat on how to use some of those produce that you have. We also have some nutrition education presentations. So if you're ever wanting us to come to like maybe your pantry or your school to just have like a little presentation on maybe how do you eat well on a budget or learning more about canned foods or how do you meal prep, we have a whole bunch of presentations that we're willing to like come out to you and just do a little presentation for you and your organization. And we also give out seeds and seedlings and garden supplies. So if your agency has a little garden, we're able to give out seeds and some garden supplies to help you with your planting season. So some programming that we have is we do a lot of recipe demos and sampling. So if at your food pantry, if you ever wanted to highlight maybe you got a whole bunch of canned beans in and you don't know how to market it to you, like your clients, we can come in and do like a little recipe demo or sampling with a little recipe and kind of push those canned beans maybe you got in. We also do field trips where the kids can come in, they can take a little walk around the garden, and then our nutrition education coordinator will lead them through like we'll lead them through a My Plate or eating the rainbow presentation, and then they'll kind of make a hummus and make a full day out of it. We also do nutrition classes and workshops. So we'll do some workshops maybe on My Plate or how to conduct your own food demo, and then some partner consultations. So if you're ever wondering, how do I get my clients to eat X, Y, and Z, or how do I situate my pantry to make sure my clients are going this way and not that way, we can come in and do a little consultation on how to reorient your pantry to make it best for your clients. We also have a half-acre urban garden out in the back where we grow dozens of different fruits and vegetables, and we produce around 1,500 pounds of produce each year. We host student groups, partners, community members, and from the produce that we grow in that garden, we distribute it out to partners, different communities, school groups, and even some of our staff. So here are some upcoming partner events that we have. On the 17th and 25th, we have a My Plate training. March 16th and the 20th, we have a food demo training. So if you're ever wondering, how do I conduct my own food demonstration at your pantry, you can sign up for that. And then on March 21st and the 25th, we have 2 garden workshops. And so the garden workshops will be located here at Capital Area Food Bank, our DC location. And then the 2 My Plate trainings and the food demonstration trainings will be virtual. And all of these trainings are free. We also have a Healthy Pantry Initiative, also called HPI, which is a health-focused, neighbor-centered initiative on 20 ideal pantry practices that pantries can adopt to kind of address the health equity in the communities. And so the 20 initiatives are listed here, and we can help through maybe capacity grants. We have an online learning center where they can kind of walk you through how to adopt some of these initiatives at your pantries. And then we also do some consultations, and we have some resources such as like toolkits, workshops, some handouts, or anything else you may need. So if you want some more information, here are some email addresses. education@capitalareafoodbank.org is like our general email address, and we can kind of forward you on to the right person. My personal email address is kmitchell@capitalareafoodbank.org. And then if you have garden-specific questions, you can also reach out to garden@capitalareafoodbank.org. Thank you.
Thank you so much. This is amazing. I feel like I learn something every day. I didn't know you had all of those resources
I know,
available,
bad 'cause I
both to
know all the
partners
time.
and providers in general. I did want to raise, Stephanie, I see 2 of your questions in the chat. And for the first one, I will tell you that there is work happening at the State Food System Resiliency Council and state legislature around changing descriptions, to minimize food waste. So we'll have to see what comes out of that, and if there's a movement within county government to, incorporate those or not. If not, that's definitely an advocacy issue, for our community to work with DHHS, on just that, because it does, support the county's other goals of reducing food waste. So that's definitely a conversation that we'll be paying attention to. But I'm sorry, Stephanie had another question in the chat about whether seedlings and supplies are meant for the food assistance provider to use to be growing on site or to give to clients.
Say that one more time.
The gardening, the seedling resources, are those for food assistance providers to grow at their sites or to give to clients to take home?
For the food assistant providers to grow on site. But I would say reach out to the garden email address because they'll probably be able to give you more specific details on that. And then I should also mention all of our cards are free of charge, so there is no fee for you to get these cards. And we really try to give them out to the community because we want people to try different recipes and try different things. So even if you're just browsing on our website and think your pantry might be interested in maybe even one recipe, feel free to reach out and we'll be sure to get those over to you.
Any questions for Kaamilah or any of our other speakers? So much wonderful information. I know it's a lot to take in though as well. Okay. And Kaamilah, I don't know. I remember years ago seeing Capital Area Food Bank cards in the produce section at Giant. Is that something that still happens, or?
I am not sure, but I will check on that for you.
Yeah. All right. I don't see any new questions coming in, but thank you to Beta for including, that is the registration link for our March food security community call. We are currently discussing with Montgomery County Planning is preparing to come in and share with us about their recently released community trends report. So we're really excited about that call, and we will share more information out when we have it. We will follow up in just a few days with the resources and the recording link from this call. Just takes a few days for us to pull all of that together. But again, I just really, really wanted to thank Jennifer and Erica and Kaamilah for all of these wonderful presentations, so much good information. And please, food assistance providers, if there is other information or training that you would like to receive on things like dietary guidelines, and healthier choices for pantries, do let us know. And that's something that we can work with the Capital Area Food Bank and their team and some of our other partners to bring together and make happen. But other than that, thank you so much for joining us today, and look forward to seeing many of you again in March, and hope to see food assistance providers on the 26th, where Pat Drumming on video on the call right now will be providing us with a tour of the East County Partners new cold storage facility. So looking forward to seeing many of you there.